Hello and welcome. Thank you for joining us today, whether you're live or on the recording for episode 26 of Dr. Jeff Talks About Sex and Intimacy, Pelvic Floor Therapy. It means so much to me that you have taken time out of your busy life to learn more about this topic. So thank you. We're on social media. We're out there on Facebook, YouTube, X, LinkedIn, and welcome to our Kick viewers. You've been on for a couple weeks and we're so glad you're here. If you're on X and you have a question, go to YouTube, LinkedIn, Facebook, Kick, or StreamYard, and that will allow you to send your question to us. Also, if you are on Facebook, we need 100 followers to be able to stream in different ways on there. So we really appreciate you following us on Facebook if you're a Facebook person. Go to the website. The website has all the previous amazing, excellent episodes with all of our great guests on there. You can pull up the calendar and see what's coming up in upcoming weeks. The website has everything you need to kind of see what's going on with all the different episodes. I hope you're listening to us in your car or wherever you are. We're where you are with your favorite music streaming service like Spotify. We're on Amazon Music, iHeartRadio. We are with you wherever you're going, while you're working out, when you're in the car. Listen, we appreciate it. Just want to remind you, you are so welcome here. Whatever your sexual orientation, whatever your gender identity, whatever your relationship style, you are most welcome here in this space to learn. And we're so glad that you're here. So, the goal of the podcast, it's really simple. It's to empower and enlighten you with the evidence-based scientific information you need to make good, informed decisions to help improve your sexual health and to deepen your loving relationships, helping you live and love more fully. In this episode tonight, we are again diving into a topic that's essential, but it's often misunderstood. When it comes to sexual health and overall well-being, this topic is not always understood, and that is pelvic floor therapy. This time, we're going to zero in more on incontinence, especially in men after prostate surgery. You've been very patient waiting for this episode because we've had some pelvic floor episodes for women, and this one is a little more geared towards men, and especially in terms of incontinence after prostate cancer surgery. With this practical information on exercise, you can do things to improve urinary control and sexual function. I am thrilled to welcome my guest, Dr. Carrie Diffuse, an expert clinician and passionate advocate for pelvic floor health. She's going to help us understand how strengthening and supporting the pelvic floor can transform lives. Dr. Carrie Diffuse is a board-certified urology nurse practitioner with advanced practice authority and a doctorate in nursing practice. With years of clinical experience treating patients across the spectrum of pelvic health, Dr. Diffuse is nationally recognized for her work in pelvic floor therapy, urologic care, and sexual wellness. She's deeply committed to holistic, patient-centered approaches that integrate education, physical therapy, and medical management to help individuals regain control, comfort, and confidence. Dr. Diffuse is also a dedicated educator and mentor, working to raise awareness about vital roles of pelvic floor health and how that plays in quality of life for all genders. So welcome, Dr. Carrie Diffuse.
Wow, thank you for that warm welcome, Jeff. I am so happy to be here.
I couldn't be more excited to have you here. These guys have been waiting for this, these guys and gals, so I'm super excited to hear what you have to say. So I'm just so happy to have you here. You're a wonderful clinician and a great educator, so thank you.
Thank you.
Without further ado, I'm going to hand it over to you. It's all you.
Very good. So again, we are going to talk about pelvic floor health and in relation to men's health and how it is not just a Kegel thing. How do I advance this? There we go. Okay, so we're going to start by talking about the ways that the pelvic floor is working and the functions and the 5 S's of the pelvic floor. And that would be sphincter control, support, stabilization, sexual appreciation, and the sump pump. So we start by sphincter control. We're going to talk about this a little bit later, but we're going to start just to give you a little idea of what it does. So of course, that's urinary and anal sphincters and how it controls urinary control, feces, and gas, and how that is going to be controlled with Kegels, of course. And we'll talk about that in a little bit. And then support. So of course, the pelvic floor is a main support mechanism. It is a hammock of muscles that gives support to not only the organs within the pelvic floor, but also to you when you're up, moving, walking around. Stabilization, so it stabilizes the core during movement while you're standing. If there's stress on the floor, it helps to give that pelvic floor support. Next slide. Then we have sexual appreciation, of course, during arousal, during orgasm. It's going to help to support that penis and the muscles that surround the penis. And then that sump pump. So it helps to give those fluids, the lymphatic fluids, which are the white cells and the infection fighting cells, and the fluids that we need for those. When it's working properly and it has proper support, it helps to push everything back towards the heart when we need it. Next slide. So here's just a picture of the anatomy. So when we're looking right in the middle there, we see the anus, those muscles that surround the anus there, that's the pelvic bowl. And that is what is going to support the bladder and help that bladder to fill and empty when we need it to do that. Then we look up and we see those muscles that are surrounding the penis there. That's what's going to help with the erections. So all of these muscles together are what help to support that pelvic floor. Next slide. So all about the sphincters. This is what we are working towards when we're talking about pelvic floor therapy. So first slide, all the way to the left. This is just going to show us that we have the prostate kind of right in the middle. Flanking the prostate on each side is going to be our urinary sphincters. That's the second picture in the middle. Kind of zones in there that we have that internal sphincter that's all the way on the top. And then we have that external sphincter that's right on the bottom of the prostate. So if we're talking about surgery and we're talking about having to have surgery for prostate cancer, then we're going to go over to the right a little bit, and you're going to see that tumor that's there in the prostate. And we're going to look and we're going to see that prostate, that's a major support organ within the pelvic floor. So that's important because what we have started to do is we've started to make sure that we are implementing pelvic floor therapy prior to surgery, prior to taking out that prostate, so that if you look a little bit over to the right, if we take out that prostate, then we're going to see that we've lost that major support organ. We see some sagging of that bladder, some sagging of muscles that will happen if we take it out. So we implement some of this pelvic floor therapy so that we get muscle memory. And muscle memory is sphincter memory. So that's part of what we'll talk about in a little bit. Next slide. Okay, so here we're going to see that little red line on the left. That's kind of above the penis. That's the pelvic floor muscles. That's the hammock that we're talking about. That's what's supporting all of the organs. It's supporting the colon. It's supporting the prostate. It's supporting the bladder. Then we turn and we flip that upside down on the right, and that's what you're looking at. There's our pelvic floor muscles. Okay, we see that anus right there in the middle. We see those big muscles that are surrounding. Again, that's the pelvic bowl that's helping to support, helping that bladder again to fill and empty. And then right above it is that little bottom of that triangle, that behind that is where that external sphincter would sit. And then a little above that is where that internal sphincter would sit behind it. So that's where we're at. What is a Kegel? A Kegel is an exercise that is a lift and squeeze motion of that anal sphincter, tightening and lifting of those muscles surrounding that rectum. If you're doing it correctly, you're going to feel your testicles pull in and your penis do a little jump up. It's not, we used to tell guys to stand in front of the toilet, pee a little bit, hold back the flow of urine, and then urinate again. So we don't want you just to do that, because when you do that, you kind of lose half of the muscles that are within the pelvic floor. So it's not just about urinating and holding back the flow of urine. It's a good way to start learning how to do it, but it's not what you want to do all the time. It's all about starting at that anal sphincter, because that will encompass all of the muscles within the pelvic floor. Next slide. So, types of exercises when we're talking about doing pelvic floor. There's two different types of exercises that we're going to do. We're going to do maintenance exercises, and we're going to do quick flick exercises. So that's all going to depend upon what's going on within your pelvic floor when you come in. We'll do an exam. We'll take a peek and we'll see, are your muscles too tight or are your muscles too loose? And depending on that, we'll specifically tailor to the needs of your pelvic floor. We'll strengthen them, we'll relax them. Typically, you're going to do them twice a day unless they're too tight, and then you'll do them once a day. So we may just have to relax you first. And then you can do those exercises. If we're starting with maintenance exercises, you're going to do them sitting, standing, or lying down as nicely. That is shown by our dog friends here. Next slide. Okay, quick flicks. So quick flicks are done for those to help to repair fibers. So first off, everybody gets quick flicks. Those are done for urgency. They're done for leakage. These are your best friend, okay? But we always flick with a purpose. We're never going to flick just to flick. You're going to get them to repair fibers that have already been lost. So everybody will have certain fibers within their floor that they've lost naturally because of long periods of sitting, because of certain surgeries they've done, or just natural aging. So we do quick flicks with every urge, always stationary, never on the way to the bathroom, but before you head there, in sets of 3 in a 1-1-3 second hold pattern. So that means you're focusing on your anal sphincter. You're going to squeeze, release, squeeze, release, squeeze, hold, release. Do that whole set 3 times. And then you would stand up and you would head to the bathroom. You would do that whether you're standing at the kitchen sink, whether you are lying in bed, or whether you're at the grocery store. And you would do that every single time. It might not work the first time. It might not work the 10th time. But with repetition, it's going to start working. And that is what is going to help to stop those leaks. Next slide. Yes, there is an app for this. Not for the quick ones, but for the maintenance. You can find it on Android. You can find it on Apple. You type in KPFE. You see that little pink icon. And whatever your maintenance exercise program is, you can punch it in. There's a little start button, and it'll tell you to squeeze, rest, and it helps to make sure that you don't have to count it in your head. Makes it a lot easier. Next. All right. Benefits of heat. So this is when you are over tight. So important to know that if you do too many exercises, then you can over fatigue the muscle, and then you can leak too much. So this is what we mean by Kegels are not the only thing that we do. doing too many Kegels can actually make you leak more. So if you come in and you are too tight, then what we do is we start with heat. Low setting heating pad to the perineum, so that means underneath the penis, over the scrotum, and over the anus. And we do that nightly, along with diaphragmatic breathing, which is just big old belly breaths, to relax that pelvic bowl, relax your setting, and to reset everything. Next. And then along with that heat, along with that deep breathing, we do a couple of relaxation exercises. These are typically done about 3 times a week to help to to elongate the core and to help to stretch out the pelvic floor. And doing all of that together, that will help to bring the tone of the pelvic floor down, which will help in turn to decrease the amount of leakage that you see. Next. Other things that can influence the amount of leakage that you can see. So sometimes your urine can be very concentrated, and that can also make you leak too much. Irritation to the bladder lining can be influenced by the amount of carbonation, coffee, tea, alcohol, acidic foods and juices, artificial sweeteners, spicy foods, chocolate, which also has caffeine in it. So any dietary influences, all in moderation. If we can decrease some of this, then that also can decrease the amount of leakage that you can have. Next slide. So what is the bottom line? How long until you're dry? So with a standardized program, which is typically once a week for 8 weeks, doing exercises typically 4 to 6 weeks. You can see small changes sooner, but usually big changes are seen 4 to 6 weeks, which with half reduction of pad usage by 3 months and about full reduction of pad usage within 6 months. Next slide. And that's all I got. Questions? This is me.
All right. Well, thank you so much, Carrie. That was great practical information. And I'm excited for our audience to hear all that. I think it's very helpful. And so, yeah, I mean, I think there's so many things to think about. And I think working with our patients on this, really making sure they're comfortable doing the exercises is really important. So I think if you're an audience member and you have a provider, it can really be helpful to work with somebody to make sure you're doing these exercises properly. And as she said, it's pretty easy to tell when you're doing them correctly or not, but it can be gauged by someone who's comfortable with that, such as Dr. Diffuse or myself. We too, before people went to surgery, would evaluate the men, teach them how to do the pelvic floor exercises, and then work with them on doing just that. So I think it's great. I also, in terms of the sexual appreciation, was thinking, it's so important because the pelvic floor actually contracts and relaxes involuntarily when you climax. So when it's locked up or it's not working right, there's lots of different problems with orgasm and sex and different things. So I think pelvic floor health is so important for continence as well as sexual health. And in 2 weeks, we have an expert coming on to talk about urinary incontinence and intimacy, which I think will be a great topic as well. I have a couple questions for you. Let's start with the first one. Is pelvic floor therapy only physical exercises, or does it involve other kinds of treatments too?
No, it also involves other treatments. So like I alluded to here, I also use yoga. I also use heat. We also do non-electric stimulation to the muscles. to help to treat that also. So it's not only Kegels.
Yep. So it's kind of a multimodal approach. And then, so I think that's really important as well. So there are different things that are done and things for you to think about and work with your provider on. But yes, there are things beyond the exercises definitely to be doing. And I think there are things to think about and work on as well. So yeah, I think that's good. Another question that came through: I'm embarrassed to talk about problems like leakage or pain during sex. How do I even bring this up with my provider?
I think a good provider brings it up to you. So you don't always have to be the one to bring it up. In my clinic, one of the first things that I bring up to everybody is I'm always asking them, how are your erections? Do you have any leakage? Do you have any concerns with your urination? So it's always one of the first questions that I'm asking when they're in my clinic. So hopefully it's being asked to you so you don't have to bring up the hard questions or topics.
Definitely. And if you do, I think it's really important because that you say, first off, this is something that is very common in men after prostate cancer surgery, but it's also can be common for other reasons. With sometimes you can have frequency, urgency, and urinary issues that way. Pelvic floor therapy and exercises can help with that too. So I think just kind of letting your provider know, hey, I'm struggling with frequency, urgency, urge incontinence, or when I cough or I sneeze, I notice a leak of urine. I think those are ways to kind of approach the subject with them. But I think if you're hopefully in a urology clinic, they're going to approach the subject with you. But just in case, it is something that is quite common. And what's great about the pelvic floor exercises is they can help with urinary frequency, urgency, and urge incontinence, as well as with stress incontinence.
Mm-hmm.
So we teach people to do the exercises. It's interesting, but from a science background, doing the pelvic floor Kegel exercises actually has a inhibiting, suppressing effect on the reflex with the bladder and everything. So it sort of calms your bladder. You think there's certain times you don't want to have to urinate, like during sex. And so there is a inhibiting effect that sex has on its sexual stimulation. But doing the pelvic floor Kegel exercises also calms and inhibits the bladder. And that's why we use it for urgency, frequency, urge incontinence, as well as for stress incontinence.
And fecal incontinence too.
Go ahead.
And fecal incontinence too.
Oh, fecal incontinence, definitely too. That's absolutely true. And so with your patients, do you have different things? I know I always tell my patients when they're like, how do I remember to do this? I'm always like, when I teach them to the Kegels, I'm always like, every time you eat, think, oh, have I done those? Now I could do it, because those are different times spread throughout the day. Are there little tips or things that you find are helpful, Carrie, with your patients to help them remember to do their pelvic floor Kegel exercises?
Well, I have them set a timer on their phone. So the Kegel app that I use, that it comes with one free reminder. So they have that. And then if they're on twice a day reminders, then I have them set a timer on their phone for the second reminder.
Mm-hmm.
And then as far as the quick flicks, that's just every time that urge comes on, then they do their quick flicks.
Mm-hmm.
So,
yeah. Good. Well, I think there's lots of things to think about and unpack. And I think that was all of our questions. So, great. I would like to it's been a lot of information, so I'm going to go to doing a little bit of a closing centering exercise for everybody, and then we'll find out what's coming up next week and close things out. So, you know how we do when we do each of these episodes, we take time because it's a lot of information. And so I'd like to go to our closing centering exercise. Let's just take a moment to breathe and center ourselves as we close this powerful conversation about pelvic floor exercises and therapy. Wherever you are, find a comfortable position. Let your shoulders relax away from your ears. Take a deep, steady breath in your nose, counting to 4. Hold it gently for a moment. And then exhale through your mouth for a slow count of 5. 4 counts in your nose. Hold it. And then gently exhale for 5 counts through your mouth. Continue that slow, deep inhale and exhale pattern. And imagine each time you exhale that you are releasing tension in your lower back, your hips, your pelvic floor. The pelvic floor is not a good place to hold unwanted tension. So every time you exhale, just feel yourself relax, release, relax into the chair completely. Your hips, your pelvic floor, your back, let it go. Let go of judgment, discomfort, or fear. Just for now, be fully present in your body. As you continue with that breathing pattern, know and realize these truths. You are more than your symptoms. You deserve care, healing, and connection to others. You are inherently worthy of love and belonging. Now take one last breath in. Exhale fully. You are grounded. You are whole. You are not alone. We are all deeply connected. That's the beauty of this world. And we're so glad that you joined us. And I thank my guest, Dr. Carrie Diffuse. It's been a wonderful episode. What's up next week, Vic?
In this insightful episode, Dr. Jeff is joined by Lawrence Levine, MD, a renowned urologist and expert in Peyronie's disease. Peyronie's is a condition that causes deformity of the erect penis, including curvature, indentation, and at times severe shortening, often leading to pain, discomfort, and challenges with sexual function. Dr. Levine shares the latest on causes, diagnosis, and both surgical and non-surgical treatments. Whether you're experiencing symptoms or supporting a partner, this episode offers practical advice, compassionate guidance, and hope for those navigating Peyronie's disease. Join us on July 8th at 7 p.m. Central Time to learn more.
Some interesting pictures there. The hoodoos and everything remind us of all this. But all of that aside, Peyronie's is a challenging issue for men. And it's going to be an awesome episode. And I can't think of anybody better than Dr. Levine to guide us through talking about that. He's going to have an amazing presentation. And I look forward to that next Tuesday. But Carrie, thank you so much for sharing your expertise on pelvic floor exercises and therapy. I so appreciate you being with us today.
My pleasure. Thank you again for having me.
Is there anything you'd like to say, any final comments that you'd like to say to wrap things up with the audience?
No.
And that's all good. So what I'd like to say is thank you. Wherever you are in your journey, if you're struggling, I know what a cancer diagnosis can be like, and I know how scary it can be. But wherever you are so much more than that diagnosis, and you're a survivor. And we're so glad you're here with us. Whoever you are, whatever your journey is, and however you wanted to learn about pelvic floor health and pelvic floor exercises, I hope this episode has been helpful. Have a wonderful, wonderful day.